Babe, I am so excited for a date tonight.
I know, I am too. Do you know what you're wearing tonight?
I don't know. I think I might wear like that new floral dress I just bought. I don't know.
I'm sure you'll look great in anything, babe.
You look so cute. Oh my god.
I have to tell you something important at dinner tonight, though.
What is it?
Well, I can't tell you right now because I have to go to class, but I'll tell you at dinner.
You're really gonna leave right now?
Yeah, I have to go to class. I don't want to be late.
Okay, that's fine.
Alrighty.
I'll see you later then. What time are you gonna pick me up?
I'll pick you up at 7:15.
Okay, perfect.
Alright, I'll see you then.
See ya. Babe, I can't believe we've been dating for like 1 month, 2 weeks, 2 hours, in about like 15 seconds.
I know, it's been the best month of my life.
Oh my gosh, me too. Wait, I need to know what you were talking about earlier. I can't wait.
Well, I know it's our 1 month anniversary, and it's a really special.
Sorry to interrupt, guys. I just had your drink. Oh no, you're fine. So you were saying?
So, I really, really, really like you.
Yeah.
And it's our 1 month anniversary, and I want to be really special.
Mm-hmm.
And I was thinking maybe that we could have sex tonight after our date.
Yeah.
Well, no. If you don't want to, we don't have to. I feel
No,
bad for asking.
no. Don't feel bad. It's just that we've never really talked about our past before with anyone else. You know what I mean?
Yeah.
Yeah.
Mm-hmm.
And I just feel like since I'm your girlfriend, like I have a right to know like who you've been with in the past.
Okay.
So how many women have you been with?
Do you think I should use a condom?
No, it's fine. I'm on birth control.
Alright, if you say so. What could go wrong?
Alright, bye. Text you
Bye,
later.
I'll see you later.
Hi, I'm Chlamydia. Chlamydia is a sexually transmitted disease caused by the Chlamydia trachomatis bacteria. It is spread through vaginal, oral, and anal sex with someone who is infected. Very often, there are no signs and symptoms, so the infection is spread easily between partners. When signs and symptoms are shown, someone may have discharge from the penis, vagina, or anus, pain in the lower abdomen, pain with urination, and they may have a fever. Risk factors include engaging in sex at an early age, having multiple partners, not using a condom consistently, and having a previous STD. Chlamydia is diagnosed with a urine sample or a swab of the discharge from the genitals. The infection is treated with antibiotics, usually doxycycline or azithromycin. All sexual partners from the past 2 months need to be treated as well. Untreated infections or repeated infections in females can lead to PID or infertility. In males, it can lead to enlarged testes, preventing them from fathering children in the future. The only way to prevent chlamydia is through abstinence or latex condoms.
I don't have a condom.
It's fine. I trust you. Just pull it out.
Alrighty, I'll see you later.
See ya.
Hi, I'm Gonorrhea. Gonorrhea is a sexually transmitted disease caused by Neisseria gonorrhoeae. It is transmitted through sexual contact. This includes vaginal, anal, and oral sex. Many times, gonorrhea is asymptomatic, meaning it shows no symptoms when you have the disease. This does not mean that there are never any symptoms. Some symptoms that may occur are increased vaginal discharge, painful urination, pain during intercourse, abdominal or pelvic pain, pus-like drainage from the penis, and or pain and swelling in the testicles. Risk factors include young age, sexual partners with concurrent partners, multiple sex partners, being previously diagnosed with gonorrhea, having other STIs. Gonorrhea is diagnosed with a urine sample and or a swab of the discharge from the genitals. Gonorrhea is beginning to have some drug-resistant strains, so doctors recommend treatment with ceftriaxone along with azithromycin or doxycycline. The best way to prevent gonorrhea is abstinence, but if that's not an option for you, latex condoms can prevent the passage of gonorrhea from sexual partners.
Babe.
Yeah.
You okay?
Yeah, I just can't give you a specific number right now.
A specific number? Like, are you saying you've been with multiple people?
Something like that. But,
Like, what do you mean?
like, I have a wild past, but that doesn't matter anymore because I only want to be with you.
I get that you're into me, but I just don't feel comfortable sleeping with someone who's had such a wild past and can't even remember who they've been with.
Yeah, I get that, but I feel like in order for our relationship to grow, we need to be more intimate.
Well, I would feel more comfortable if you got tested.
Tested?
You know, for like STDs. You can go to your clinic, primary care doctor. I'll even go with you if you feel more comfortable. But it's just to know if you're clean or not.
Well, would you be more comfortable with me if I got tested?
100%.
And then we can have sex?
And then we can have sex.
Alrighty, I'll go tomorrow.
I'm Martina, I'm going to be your doctor today.
Hello.
Hi, I'm Maddie. I'm going to be your nurse today.
So what's going on with you?
Well, I've got some pain while having sex. I've got really bad pain when I urinate. I have abdomen pain and I have testicular swelling as well.
Okay. So it sounds like we maybe have like an STI, STD thing going on.
Yeah, my girlfriend wanted me to come get tested.
Okay, so in the past like couple months, how many partners do you think you've had?
2 or 3.
2 or 3? Okay. So I'm gonna have you actually change into this gown. We'll leave in a couple seconds, and then Maddie will come back in and get a couple swabs and like a urine test, and we'll
Okay.
figure out what's going on, and hopefully we can fix ya.
Alright, thanks, Chief.
All right, we'll be back.
Alright.
Hi, Jake.
Hello.
How we doing?
Not too good.
Not too good. Well,
No, still in a lot of pain.
we got a couple test results in.
Okay.
So we're gonna talk about a few things. You did test positive for gonorrhea and chlamydia.
My girlfriend, she's gonna kill me.
Well, I'm happy you told me you have a girlfriend, because if you guys have had sex, I would want her to come in and get tested too.
No, she wanted me to get tested before we did.
Okay, so we're gonna backtrack a couple months to what you've been doing. So you said you had 2 to 3 partners.
Mm-hmm.
Did you use protection?
No.
No? Okay, so that's probably where you got these infections from. Do you
Okay.
know who these girls are?
No, I don't.
No? Okay, because I would like them to come in and get tested. All right, so the good thing about these is they're treatable.
Okay.
So I am going to prescribe you an antibiotic. I'm going to prescribe you doxycycline. You're going to take it 2 times a day for 10 days straight.
Okay.
Have you ever been on an antibiotic before?
No, I haven't.
No? Okay, so I want you to take the full dose even if your symptoms are gone and you're starting to feel better.
Mhm.
You never want to share with anyone else, and you shouldn't keep the pills because you should take the full dose. So I also want you to refrain from having sex for about a week.
Okay.
All right, and you said your girlfriend, you guys haven't had sex, so I don't want her to come in and get tested, but you should tell her about these results,
Mhm.
because you don't want her to get infected.
Right.
And also to prevent spreading this is I want you to start using condoms.
Okay.
That's going to be the best way to protect against any like infections, because we don't want you to get something that you can't get rid of. Because you're
Okay.
lucky that antibiotics will treat this, and you should be good to go. But I definitely want you to start using protection and talk with your partners, like you and your girlfriend are, to make sure nothing gets transmitted. All right?
Okay.
Do you have any questions for me?
Nope, not right now.
No? All right. Well,
Thank you.
let you go, okay?
Alrighty, thank you.
Bye.
Hey, babe.
Hey, what's up?
Nothing. I got a few things I gotta tell you.
Okay.
So, I went and got tested, and it came back that I have chlamydia and gonorrhea. But they're both treatable with antibiotics. So the doctor said that I can't have sex for a week, and that I should be cleared of all signs and symptoms in 2 to 3 weeks, and that I have to use protection if we have sex.
Okay, that's okay. I'm just so glad that you got tested and everything, and that like you're all cleared now, and like I'm glad that we didn't have sex.
Mhm.
But definitely we'll use condoms.
Yes.
Okay.
Hey, Jake. I had a lot of fun at the beach today.
Yeah, it was a good time. Oh, I forgot my condoms in my beach bag down in my car.
It's okay. I'm clean.
All right, I'll see you around.
See you later. Hi, I'm genital herpes. Genital herpes is a sexually transmitted disease caused by the herpes simplex virus type 1. You can get herpes through contact with herpes lesions, mucosal surfaces, genital secretions, or oral secretions. Herpes lesions appear as small blisters or vesicles in the genitals, rectum, and mouth. The clinical manifestations vary between first and recurrent outbreaks. With first outbreaks, signs and symptoms are fever, body aches, swollen lymph nodes, and headache. With recurrent outbreaks, signs and symptoms are genital pain, tingling or shooting pain in the legs, hips, and buttocks. These can occur hours to days before lesions outbreak. These symptoms last a shorter duration and are less severe than with the first outbreak. Vesicles break and leave painful ulcers, which take 2 to 4 weeks to heal. Risk factors for genital herpes is multiple sexual partners, not using a condom, having STDs previously, having sex at an early age, and the base risk factor is having sex without a condom. There's no cure for herpes, but you should take antiviral medications to prevent or shorten these outbreaks. Herpes can be passed from mother to child during pregnancy or childbirth. Infants can be infected shortly after birth from drinking breast milk. This can result in a potentially fatal neonatal herpes infection. Women with genital herpes should take antiviral medications late in pregnancy and through delivery to decrease the risk of herpes being passed to the baby. Preventing herpes. You want to wear a condom every time and make sure it is applied correctly.
Wearing condoms does not eliminate the risk of acquiring genital herpes because the lesions could be shedding in areas not covered by the condom. A person with herpes should not partake in sexual activity when herpes lesions are present or herpes signs and symptoms are present. But even if signs and symptoms aren't present, they can still infect their partners.
Hi, Jake. Nice to see you again.
I got bad news.
Bad news? All right, well, this is my nurse, Jolie. So what's going on?
Well, I took the course of the antibiotics and everything was good. And then I was on vacation last week and I had unprotected sex again. And now I have sores on my genitals
Okay.
and they're not healing.
Okay. Do you know this person?
No.
No, so you don't know anything about their past.
Mm-mm.
Okay. So I'm gonna have Jolie take a couple blood draws, and we'll get you tested for another STD, STI. Unfortunately, you
Okay.
really, really, really need to be good about using condoms. Okay.
Mm-hmm.
All right. So we'll get those tests, and we'll see what the results are. Okay.
Alrighty.
All right. All right, Jake. So we got some test results.
Mm-hmm.
This feels like a little bit like deja vu. Wish we weren't having this talk again. So we did test you for herpes, and it did come back positive.
So what does that mean?
So herpes, basically, it's incurable, and the lesions you have now on your genitals means you are like the most contagious right now. You will always have this, even without those lesions present. So that's something you definitely need to be aware of, because you can infect, like you will have this for the rest of your life, and you can infect any partner you have if you don't use protection, even when you don't have those lesions. So there are antivirals I can give you that makes the lesions go away, but this is something that will be with you the rest of your life.
So no antibiotics will help anymore?
Nope. You know, we tried to get you to use the condoms to prevent something like this, because now we're at a point where we can't really do anything for you, and this is something you're gonna have to live with for the rest of your life. So now you really, if you care about your partners and your girlfriends, you really are gonna have to wear a condom, and you need to let them know about this,
Alright.
because it's something that you don't want them to get either.
Okay.
All right. Do you have any questions?
Mm-mm.
No? All right. Well, hopefully I don't see you again. All right? And make
Mhm.
sure you use condoms, okay?
Alright, thank you.
All right. Have a nice day.
So tell me about your trip.
About that, I have something I have to tell you.
What?
So during the trip, I had unprotected sex again with somebody else, and I went and got tested again, and it came back that I have herpes. And-
Herpes.
yeah, and it can't be cured.
So you cheated on me.
Mm-hmm.
I am so done.
Where are you
Like,
going?
so done. Goodbye, Jake.
I say I'm too late. Got nothing in my brain.